Assalamu alaikum. We hope you all are doing well. So, I am Dania Ahmed and I'll be moderating today's session. Our today's session is an informative session, and the topic is pain and faith. We'll understand this topic through neuroscience. To truly appreciate this topic, I'll reflect on a Quranic verse. Bismillahirrahmanirrahim. We will certainly test you with fear, hunger, loss of wealth, life, and fruits. It's Surah Baqarah, ayat number 155. Our today's presenter is Dr. Najeeb, who will further guide us on this topic. There will be maximum 40 minutes for the presentation, and then we will have the Q&A. May Allah put barakat in their words and allow us to benefit from this session. Dr. Najeeb, the floor is yours now.
Assalamu alaikum. My name is Dr. Najeeb Ranginwala. First of all, I'm very thankful for Allah. Please recite the Durood Sharif. Bismillahir Rahmanir Rahim. Thank you very much for inviting. First of all, I'm very thankful for Allah for giving me opportunity to share my knowledge. May Allah forgive me if I have a shortcoming. Anything good is all from the blessing of Allah. Okay, and first, also, I'm very thankful for IMS to allowing me to provide this platform to share my knowledge to you, and also like to thank the audience. In spite of a lot of things happening in your life, you took time to come to this presentation means a lot for yourself and your family and for everybody because you're going to share the information, correct? So I'm thankful for that. And my job is to convey the information to you, and then it's up to you. Wallahu alam, Allah knows the best. Okay. So let me start the presentation. Hopefully you have followed the presentation in the past. We had a pretty good crowd right now, above 150 people, so that's good. So this is the introduction. So what I'm going to say, these are things I'm going to concentrate, and we'll go from here. So pain and faith. This is a significant important topic. In my past, somebody asked me the question, and that is one of the significant questions that when people are, some of the people, when they have good faith, they don't feel the pain, right? Why? Do you have the answer for that? The neuroscience really explained the answer. It has been known for more than 50 years. So the question, my job is to make you understand what is pain, what is faith, and how the transformation of power of faith on discomfort through neuroscience. So we need to understand that, and that's a very important thing. So I will use the flow chart, which I have used in the past, so that you can think about it for those answers. Then I like you to review, hopefully you have reviewed my previous presentation on IMS. I have done more than eight presentation in the last year. Each presentation is about 40 minutes and followed by 1 hour discussion. And this is a continuation of that. So we learn something, then they move forward on that. So it's a build up. So if you're listening to this presentation, you have missed a lot. I'm just letting you know because you will be grasping a lot of information and sometimes you will be blank because that has been significantly discussed in the previous presentation. Then I will go into the Holy Quran verses because that is where the guideline comes from. Means that's the golden rule. Means as long as the Quran says that and the neuroscience establish that's the pathway, that's how the neuroscience works. So Holy Quran verses are the golden rule and neuroscience trying to explain how it happens. So our belief is stronger, right? We need to understand how it happens, where it happens. So if you know all the foundation correctly, it will help you. And then I will go into the pain and faith, then the neuro paradigm in the mind and body. Then also we need to think about cognitive network and thinking. So there's a lot of education taking place. So you need to bear with me how it happens in your system, correct? And how the mental and emotional resilience comes. Faith is all about resilience. Sometimes the faith is high, sometimes low. Why? Means you are started with a faith, why it goes ups and downs. So you need to understand where the resilience is and how to get resilience. And then finally, critical question and mega cognitive thinking, correct? And then we will go into question and answer session, correct? So these are the questions you should be thinking. And you should think and have a good answer for that. And this is where the presentation goes into detail, correct? Does perception of pain comes from the brain or the mind, or is coming from the heart? You need to know very clearly. And what are the reason behind that? Because you cannot say, I guessed it. We know the answer for more than 100 years or more than 50 years. So you should know by reason. So I want you to think that way. Does the belief affect the perception of pain? You need to understand what perception is, right? These are very simple, straightforward phenomena you need to understand, correct? Does the physical pain affects the belief? Yes or no? And what's the reason behind that? Think about it. Does the emotional pain affects the heart or the mind? Need to know what it is and what's the reason. Does resilience affects the pain and belief? Need to know. Does belief changes the delay gratification from punishment to reward? This is pure psychology, helping the understanding the concept of Islam. Pure psychology. If you understand that, you understand from psychology the depth of Islamic concept is. Is pain a paradox, bringing you closer transformation or pushes you away? Why? Is pain something to escape or something to understand the situation? You know, these are very basic questions all of us goes through. And the answer is there. It's in the Quran, it's in psychology and psychiatry, in neurology. If we didn't look for it, that's our shortcoming. I just want to share with you. And you need to go up and beyond. Wallahu alam, Allah knows the best. But I'm going to share my information to you and knowledge to you. Right? So answer to all these questions come from this flowchart. So if you have understood my previous presentation, I went into minor detail of this flowchart, and it has been updated. So it has been updated. So I added more information. But you should know what is qalb, what is ruh, what is nafs, and the qalbs are three different types. The nafs are three different types: nafs ammara, lawama, and mutmainna. Correct? What is ilm? What is akal? What is hidayat? What is love? And what is hikmat? Right? These are all from Quranic concept. Correct? So don't say that you don't know about it. I added more and combined psychology and psychiatry here. So you understand when Allah says so much about qalb, why? There's a reason why qalb is so much emphasized. There's a reason why ilm and akal was emphasized. Rabbi zidni ilma. May Allah increase our knowledge. Why? There's a reason behind that. Correct? So I added up more information regarding neurology and psychiatry, where they get connected and how do you learn from it. Correct? I may not go in minor detail on each one of them because it has been discussed in the past. But the answer to all these 8 questions is in this graph. And it's our duty to understand Quran and psychology and psychiatry to get the right answer and the reason behind that. It's important to understand the reason because the faith lies in the reasoning. Is it the difference between a belief and a faith? There is a difference. So if your belief is strong, then it goes into the faith form, right? So you need to know the reasoning, right? And go from there, right? So going into further detail, I went into detail about this also. What is qalb, what is ruh, and what nafs. Yes, sorry. So I went into detail. What's the difference between ilm and akal? You need to understand that, correct? If you don't understand, you will be little much confused. Ilm is the data, akal is a software, correct? And then you have different type of ilm, ilm nafi or ilm ghair, correct? Non-beneficial versus beneficial, and how the hidayat and hikmat helps you, correct? And the akal is akli nazira was akli amli, correct? Beneficial versus non-beneficial. Akal helps you also, correct? So we discussed that thing and it affects your qalb, and the qalb is the one who decides what to do. And the nafs helps the qalb in a bad or good direction, correct? Perfect. So we have to understand this is the flow chart from the Quran, correct? Pretty much Quran and Hadith that you have the qalb. Qalb is affected by ilm and akal, correct? You need to understand the difference between ilm and akal. You cannot sit on and say that they are the same. Ilm is the knowledge, the data. Non-Muslim also have a data. Akal is something different. So you need to understand how it works and what is requirement for the akal. When you want to have hikmat, you need akal, correct? So there is a requirement for the akal that hikmat requires the akal with the ilm, correct? And all those things. So this was already discussed in the past that how the Muslims have so much higher level of thought process when they have hikmat or hidayat, correct? And this was very much explained in the previous past, correct? So at least you have idea. These are the previous presentation. I wish you have listened to it. I went into minor detail. There are 8 of them. It's available 24 hours, 7 days a week, and you can listen to it and it's a 40-minute presentation followed by a 1 hour discussion. So you can do that. Okay. These are the different verses I'm going to go through it before I do the presentation. Like Surah Baqarah, we will certainly test you with fear, hunger, loss of wealth, life, and fruit. What is that? Allah is checking your faith, correct? And pain when you lose all those things, correct? Allah is telling you. The second is Surah Baqarah, verses 286. Allah does not burden a soul beyond what it can bear, right? Or Surah Insha, indeed, hardship comes with ease. Indeed, the hardship comes with ease. That's a significant verse. You need to understand psychology when hardship comes with ease. Why Allah saying ease? Hardship with ease? You need to understand why Allah is asking. What is it? Right? Psychology explained in detail. Surah Baqarah, verses 214, Messenger and those with him said, when will the help of Allah comes? These are at the time of all the turbulence and all those things. Sahaba were tested for their faith, and they were asking this question, and Allah put that verse over there. So we need to understand. Surah Baqarah also, indeed, Allah is with the patience. Why Allah asked for the patience? Why? And then Surah Allah. Does it not know you that Allah is observing all things? Nay, let him know that if he does not stop, we will drag him from the forelock, the lying, sinful forelock. Very important ayat. Why Allah emphasized lying, sinful forelock to Abu Jahl? There is a significant information given here. A lot of people don't even think about it. Forelock is just one area of your body where you do sijda, the front or the area where you do the sajda, the forehead, nothing else. So the forehead area where you think, where you, of course, you have to have a memory. Then you are going to think. Then you're going to lie. You will do sinful act. That means you are going away from your faith. So Allah is telling where your location is. This is Allah's wording, and you cannot deny that. A lot of people deny this thing, and that's a problem. Okay? Surah Anam. Surely those who listen to our revelation with open mind will accept the truth, and for those who are dead, closed mind, Allah will bring them back to life on the day of judgment, and then Him will be returning for their recompense. Right? Surah Taha, my Lord may increase my knowledge. And Surah Araf. Certainly we have designed many jinns and human beings for hell. And those one who have qalb, I use the word qalb because that's exactly Allah says, with which they do and do not understand. They have eyes with which they do not see. They have ears with which they do not hear. They're like animals. And even worse, there are those who are heedless. Such a hikmat is mentioned here. We just slide this ayat without pondering, correct? To understand all these ayat, you need to understand about yourself, how you think, how you understand things, correct? For that, you have to understand neuroanatomy. You understand neurology, correct? You have to know the system, the cardiology, and all those things to know that well. So let's come to the main core topic. You can have a physical pain or emotional pain, correct? These are pain, but where they affect, it affects your limbic system, prefrontal cortex, cingulate gyrus, and other areas of the brain. This is where the pain affects. So pain is basically uh, sensory stimulation, but it needs perception. Where the perception is, perception only takes in the brain to acknowledge this is a pain. So don't change the definition because you didn't get it. It's in written there. So please don't change the definitions. Correct? So the perception of pain takes place in the brain. No other organ takes the perception of pain. We already, and I will establish it, right? That's another story if you don't want to follow it. That's your choice. But we know for more than 100 years the pathway, the system, how it works. Do fMRI, do MRIs. On the spot, you will get the results. So if you don't know and you have your own idea, that's your thought process. But that does not work in real life, right? So you need to understand where it works and what is the facts. Don't make facts into your what you think. That's called cognitive biases. That's why we don't understand Quran so well, because we have cognitive biases and fallacies, because we make our own thought as that what Allah is saying. Allah said in the Quran in Arabic, but we change the translation to our thinking and then create cognitive bias and then say, well, we didn't understand it. Of course you didn't understand, because that's what not Allah said. Allah said in Arabic. You translate to the best of ability, but maybe at that time that translation is not the best translation. And so you're following the translator, not what Allah said. So that's the difference of cognitive biases. Follow Allah, not follow the translator's meaning. That is what Allah will ask you. You have given 30, 40, 50 years of life. What did He do? Correct? So you need to understand where is the facts are rather than think that way. So all the pain of emotional pain goes to your limbic area, which is in the brain. Now you have emotional pain leads to emotional reaction. What is emotional pain? It is a signal, like for example, you see from the vision a painful thing going on, that's create emotional pain, and you get emotional reaction. Emotional reaction is an expression like fear and sadness. So see, understand, emotional pain leads to emotional reaction, but it's happening in the brain, in the mind, no other organs right now. So don't add things which you don't know. So let's come over here. The neurotransmitters from neurology, from psychiatry, you have pain. These are different neurotransmitters. Substance P, glutamate, endorphin, GABA, norepinephrine, serotonin, right? A lot of them are similar, but they have tracks in the body, how they pass on the information. And this is what you need to understand from neurology, psychiatry also. So perception is interpretation of sensory input by the brain. Remember, it's by the brain. So the pain comes, the signal comes, and it has to be received and understood. If it's not understood, it's not a pain, correct? And where it's understood? In the brain. So these are the pain, neurotransmitter, and neuromodulator. Neuromodulators are the one that increase or decrease the effects of the neurotransmitters, correct? Now, perception and mood. Perception and mood take place in your brain. It has been proven in neurology and psychiatry. By the way, psychology is study of mind. So why we keep on telling it's coming from the heart? That's called cognitive bias, correct? If you're studying from psychology, which is study of mind, if you want to study heart, you go cardiology, right? So understand that. So perception and mood, these are the neurotransmitter, correct? These neurotransmitters like serotonin, dopamine, oxytocin, this is bonding, cortisol, endorphins, norepinephrine, these are produced. And memory and faith, they are all connected, and these are all connected. For faith, you need to have a memory system. Without memory, you cannot have faith. Because how can you have faith if you don't have a memory? Correct? And what are the neurotransmitters? Serotonin, dopamine, acetylcholine, oxytocin, glutamate, norepinephrine. Memory is the storage and recall of sensory information. You need a memory system. Correct? So where is the memory system? So before we go into memory system, let's go talk about pain. So these are pain receptors I'm taking from clinical neuroanatomy. These are the open nerve ending, the pain receptors, where they are there. I will go very quickly now. We have a pathway like these areas where the neuroreceptors are, and it's passed through the lateral spinothalamic tract from the spinal cord, goes to thalamus. That's in the brain. Then it goes to different areas of the brain to modulate, understand what type of pain. Is it sharp pain, deep pain, dull pain? All this happening in the brain still has not got to the heart. Do you understand? It's still in the brain, and the brain decides what to do. Whether I proceed further or I block it. Now, I'll give you an example of blocking. Hazrat Ali. When he was in the prayer, he didn't have pain. Why? That's the answer. He has a blocking mechanism from here to here, but when he goes into the prayer mode, the faith is so strong that it's blocking the pain in the brain. We know in psychiatry and neurology that's how it works. So now you understand why he never got the pain when there was a arrow in him or he is cut so badly. Because his faith was so strong that it was giving all the inhibitors that pain was not perceived. Although there was a pain stimulus coming out, but he was not perceiving it. That's from neurology and psychiatry. We all know that. So there you go. Still, heart is not involved here, correct? This is perception. These are different type of pain: superficial pain, deep pain, neuropathic pain, visceral pain. It goes over through the spine, from the spinal cord to the thalamic area, different region of the brain. They are modulated over here as well as modulated over here, and then it decides whether to do or not. So, and it's influenced by the brain to increase, decrease, nullify, what to do about it. This is all happening in the brain, not in the heart right now. And if the brain stop it, shut it, you're not going to feel it. Correct? Still not heart is involved here. So brain has this capacity. So you need to understand what, and this is all in neurology and psychology and psychiatry. For more than 100 years, you can go through it, and has been proven again and again. This is the structure of the brain. I went into detail. Last time I explained these are the pathways you have when you get the impulse or anything. You get a salient network, which is autonomic thought process, which is happening over here, the limbic system. You respond right away. Or if you take a little bit time, it goes to the frontal lobe, correct? Suralak, correct? Thinking process. And if the prefrontal cortex act, think about it, send the information here to calm you down. Then we have default mode network, deeper thought, where you are in prayers, when you are in deep thought. There's other area of the brain that kicks in. It's called deeper thought. This is called default mode network, which we have it. Neurologist goes into detail. And then further, you have mega cognitive regulation system, which is in Broadman area 10, which is actually located over here in the prefrontal cortex. That controls all these three to decide what to do. That's why Allah liked the sister, because you put your ego down. You put everything down in front of Allah. What are you putting down this area? You're putting your identity that everything belongs to Allah. All your knowledge is Allah. You don't have it. Allah loves that, correct? There's a reason why Allah loves some things. And we need to understand that concept. If you understand neurology, you get the point across, right? And it's called megacognitive regulation, which take place over here. In the previous presentation, I went into Zami, common sense, and critical sense, correct? And these are the pathways. These are all the things I was discussed in the past. You need to know awareness. You have consensus Zami, but that's a default mode network. And I explain how to develop default mode network. These are the pathways where you get moral accountability, awareness of Allah. In a common sense, it's a daily uh, routine when you do it. But in critical sense, you do the frontal lobe, but not to a higher degree, correct? I went into detail, so I'm not going to spend that. This is the pathway in the brain. You have that memory center, which is hippocampus. This is one of the major memory system, correct? And ventral tegmental area, which release the neurotransmitter to the reward and the punishment pathway. They are always active every second. And the prefrontal cortex, this gives impulse back and forth, and you decide. This is the pathway already established in neurology and psychiatry. If you don't understand, this is how it is, correct? So it's very important to understand what is megacognition. It's a management of all thinking in the mind. It's a critical thinking in the quality of thought. Megacognition is the drive of all thinking. It's like an engine. Controls, connect, and optimize thinking. This is what it is. It lies in the frontal lobe. So neuroimmune cardiovascular circuit is the new theory, which is right now established how the brain connect to all of the body, and is published in Journal of Cell in 2023. This is the human brain. This is the prefrontal cortex where you think, frontal lobe. This is where the memory centers, all those things and all those things. So this is occipital lobe, which is the backside of the brain, and this whole brain is connected. This is actual human brain. So at least you have idea. This is how all the connections in the brain take place. I'm just giving you outlook. So how the memory system works. So if you have faith, you have memory, correct? So you have declarative and non-declarative memory. Declarative memory relates to the events and the facts, correct? And the non-declarative memory is the procedure memory, perception memory, classical condition, and non-associative learning, correct? So these are memory system in your brain. That's where the faith comes in, right? Faith without memory does not exist, correct? So you need to understand it's all, and this is how they are connected each other throughout the brain. So I'm just explaining all with all these receptors. This is all in the brain. So when you see from the eye, as one of the ayat says, it's not you see from the eye. The initial image is formed in the eye. It goes through optic nerve, optic tract. It goes into different areas of the brain. Brain analyze it. So you basically see a vision in the brain, not in the eye. That's the initial sensory stimulation in the eye. But then the brain decides what it is. Is it a human? What type of information you're getting? Is it a good or bad? Is it painful or not? This is all brain does it. There is no heart involvement right now. And the brain has decided yet that this is the information. Later on, it sends the information to other areas of brain, from the brain to other part of the body, but the brain decides this thing. So you need to understand this the concept. This is how the track in the brains are. This is all happening in the brain. So if somebody is saying it's happened in the heart, they need to learn more about rather than have cognitive thinking, cognitive biases. So these are all the connection in the brain, and that's how it works. So you have this reward and punishment center always works together and go forward. And we need to understand with the faith, it controls these things, and the prefrontal cortex controls it. So we need to understand how it works. This is the fMRI. So when you think, this area lights up in fMRI. It tells you which area of the brain activates when you're thinking, correct? So it's all happening in the brain, not in the heart. These are all the connection, how it's connect from the brain to different part of body. These are all taken from Frank matter, correct? So that's it. Finally, you need to understand resilience. Faith has resilience, ability to bounce back from difficult times requiring thinking, habit, and adopting the standard paradigm, correct? So resilience is very important in our faith. Resilience is a habit that sustains the faith. So if you read Quran first talk about patience, correct? Why patience first? When you have something not favorable, Allah talks about patience. Because in psychology, it tells you, because your prefrontal cortex kicks in, your default mode kicks in, right? And that requires time to have patience. And then you have to have trust, correct? So that is very important connection you need to have, correct? Followed by prayers and understanding, correct? So what happens with the prayer is basically you are connected to Allah to understand all this concept, right? You give all the high power to Allah and learn from it, correct? And to have understanding. So prayer is very important to develop resilience, that it tells you to calm down to a deeper mode, default mode network. And then you have a bigger thinking and understanding. Positive mindset and gratitude. Gratitude is significantly important in Islam. Why? Because reward and punishment kicks in. When you have a punishment phenomena, when something bad's happened, if you have faith and you have a understanding of the concept of Islamic, that pain transform into reward. That's the gratitude, through gratitude. When you have gratitude, the pain become reward. Then you will like Allah. Okay, may Allah forgive me for my shortcoming and give Allah more testing for me, right? That's what the concept is. So pain and punishment is always kicking in, but the gratitude pushes the pain to the reward phenomena. And when you have a reward phenomena, you are looking for a positive mindset. This is positive mindset. That's what Muslims have. So you need to understand from the brain how things it works. Critical thinking, tadabbur, correct? When you do tadabbur, what you're doing, metacognition, you're thinking about it, and which psychiatry or psychology talks about it, correct? And coping stress management by creating healthy boundaries. So you have a system in your, when you control breathing, your autonomic nervous calm down, correct? When you're walking, it calms down. So your response to stress goes down. So you have a flight and fight reaction goes down, and you have a thinking process kicks in because you're not under threat, correct? So you need to have healthy boundaries and positive social support. That's what it is. Why you have 5 time prayers? Positive social support. So you get support from each one. So you're not by yourself. These are great understanding that brings your resilience back, right? These are the great concept of Quran, which we understand from psychiatry, why it was said to you, why it was forced to you that please do that. And that developed resilience. Okay, so let's come to all these questions, correct? And I told you these questions will be answer based on the flow chart, right? And then we can go through it. So the first question is, does the perception of pain comes from the brain or mind or the heart? And if you look at it, it's come from your brain. Because perception is understanding of the pain and perceive it what it is. Is it a pain or it is something else? So where to receive? I have already told you it's to receive in your mind, in your brain. So it is from the mind or the brain, not from the heart, correct? You need to understand, right? The second question, the belief affect the perception of pain. Belief is acceptance, correct? Belief, if it's higher, then you develop faith, right? So belief affect the perception of pain. Definitely it affect the perception of pain because it's all happening in your mind, in your brain, correct? So the more stronger belief have, then you have perception of pain comes and you can modify your pain or modulate your pain, just like Hazrat Ali did, right? So it's coming from your belief have that thing, correct? The next question is, does physical pain affects the belief? Yes, physical pain affects your belief. But if your faith and belief is strong, it modulates that, right? This is coming over here. It does affects. The next one is, does the emotional pain affects the heart or the mind? And we have established beyond, to my best of knowledge, that the emotional pain affects the mind because all the emotional, the limbic system is in the brain, correct? So it is the brain where it is get affected, your mood symptoms, like deep brain stimulation. You put deep brain stimulation, the person who is depressed come out of depression very quickly in a matter of hours, who is extremely depressed. We have different modulation for the depression and other things which we do, correct? So it affects your brain, correct? The other one is, does resilience affects the pain or and belief? Yes, the resilience affects your pain because it decreases your pain and increases your belief. And resilience lies in your mind, right? You think, you go towards Allah, right? The next one, does the belief changes the delay gratification punishment to reward? Yes. What is delay gratification? Delay gratification is a phenomena where you have patience. When you have patience, your nafs is going towards nafs mutmainna. When you have nafs mutmainna, qalb is more satisfied, is not bothered by nafs amara, nafs lawama, correct? And then it will help you. And the ilm and akal, which we talk about it, with the help of hikmat, love, and hidayat, will help the qalb to get to qalbi salim, right? So delay gratification is significantly important. Why? Psychiatry explain that. Is the pain a paradox bringing you closer or it pushes you away? It depends on your faith, right? And faith is where? Is in your mind. It's in your brain. So if you think about it, what did you learn? What is your faith? What is your memory? And that tells you. Is the pain something to escape or something that understand the situation? Faith, pain make you realize. So the people who are have a moment, they are being tested. The people who are not, we feel it's a misery. So the pain make you realize it's Allah is testing or Allah is giving you punishment, right? So you need to understand from thinking process, right? So that's my end of the presentation. If anybody has question, please most welcome to ask this question.
So moving towards the Q&A session, make sure to keep the questions relevant and precise. And if you have more than one question, ask the best one here. And for the rest of your questions, the feedback form is being shared in the chat box. You can ask your rest of the questions in the chat box. Those who have questions, raise your hands and I'll unmute you and you will ask the questions.
जी जी मैं पूछ रहा हूँ सर कि पेशेंस का सब्र का जो रियल डेफिनेशन है ना तो वो क्या है सब्र किसे कहते हैं बर्दाश्त करने को या कोई और चीज़ है क्योंकि
Okay.
सफेद जी जवाब देते
Okay, that's बहुत अच्छा आपने सवाल किया। पेशेंस आपको अंडरस्टैंड करना पड़ेगा कि किस पे आप इस्लामी तरीके से आप अंदाज से आप सोच रहे हैं, करेक्ट? पेशेंस, सब्र, ठीक है ना? सब्र इज रिक्वायर्ड। व्हेन यू अगर आपको कोई मुसीबत होती है या टेस्टिंग होती है तो दैट्स द फर्स्ट थिंग यू डू टू डू सब्र, फर्स्ट ऑफ ऑल टू अंडरस्टैंड क्या हुआ है, करेक्ट? यू नीड लिटिल बिट मोर टाइम टू अंडरस्टैंड दैट, करेक्ट? अगर आपके अंडरस्टैंड फ्रॉम द फ्रंटल लोब से कहता है कि यू आर डूइंग द राइट थिंग, यू आर फॉलोइंग व्हाट इज रिक्वायर्ड बाय अल्लाह, देन यू हैव टू डू सब्र, करेक्ट? बट इफ somebody is doing wrong, then Allah said you have to act on it. Then sabr has its own limitation, correct? अगर कोई आपको जान से मार रहा है, किसी को हलाक कर रहा है, तो उसमें आप सब्र नहीं कर सकते, right? So sabr has its own healthy boundaries, and where you don't follow the sabr, but you do proactively things you're required to do, correct? Islam says that. So Islam has a definition where it stops and where you do something more than sabr. अगर आपको हेडेक हो रहा है तो आपको उसका इलाज करना है, करेक्ट? अगर आपको मेंटल हेल्थ इश्यूज हैं तो आप सब्र नहीं कर सकते, आप उसका इलाज कर सकते हैं, करेक्ट? क्योंकि हुजूर सल्लल्लाहु अलैहि वसल्लम ने भी जब उनको हुआ था तो हुजूर सल्लल्लाहु अलैहि वसल्लम भी चीज़ें लिया करते थे, तिब नबवी, आपको पता है ना? लोगों से, हजरत आयशा एंड दूसरे लोगों से मालूम किया कि इससे बेनिफिट होता है तो हुजूर ने किया था, करेक्ट? सो ये मतलब ये नहीं कि हर चीज़ में सब्र करना है, सब्र हैज़ ए लिमिटेशन, करेक्ट? होपफुली आई आंसर योर क्वेश्चन।
Sorry for the inconvenience. Abdullah, you may ask your question, please. Ji Abdullah.
So I have a question. I'm struggling with a habit that I try to quit, and I managed to stay away from it from sometime like 1 month or 3 months, but then I end up going back to it again. Sometimes my Iman feels matlab, strong, and sometimes it becomes weak. Could you please guide me on how can I stay consistent and avoid falling back into it again?
बहुत अच्छा आपने सवाल किया। तो ये आपका नहीं, बहुत से लोगों का भी मसले होते हैं, करेक्ट? इट्स अ वेरी कॉमन थिंग कि दे डू समथिंग, दे एबल टू सस्टेन फॉर अ मंथ एंड देन दे फॉल बैक, करेक्ट? ये होता है, ठीक है ना? पहले तो सबसे बड़ी बात है कि आप सोचते कहाँ से, अपने दिमाग से सोचते हैं या दिल से सोचते हैं, करेक्ट? यू नीड टू अंडरस्टैंड दैट, बिकॉज उसकी रीज़न मैं आपको बताना क्यों। अगर आप दिमाग से सोचते हैं तो आपका कॉन्शियस माइंड एंड अनकॉन्शियस माइंड है, करेक्ट? There is 80% information is coming from unconscious mind towards going towards conscious mind. ठीक है? We all know that, which involves the emotion, which involves lot of factors, correct? Unconscious mind and conscious mind are very active. अगर आप दिल से सोचते हैं तो where the conscious unconscious mind will come? तो ये तो आपको पहले तयन करना है ना सिम्त का, कि कहाँ से हो रहा है। आपको पता है कि अगर आप हार्ट से करेंगे तो वो तो आपको हेल्प नहीं करेगा क्योंकि you're lost here, correct? आपको अपने दिमाग से सोचना है, जिस पे आप अकल इस्तेमाल करेंगे, हिकमत इस्तेमाल करेंगे। अकल, अकल, इल्म, हिकमत, हिदायत कहाँ पे है? आपके दिमाग में, करेक्ट? तो अगर वहां से सोचेंगे तो फिर ये होगा कि आप अपने आप को करेक्ट करेंगे। इट्स अ हैबिट। सो आपको हैबिट को भी करेक्ट करनी होगी। मेरा प्रीवियस प्रेजेंटेशन दो हैं ऑन हैबिट्स के, कि हाउ टू improve योर हैबिट्स, what are the factors required to increase good habit, and what happens when you do bad habits and difficult. So अगर आप उस presentation को सुनेंगे, it's a whole 1 hour presentation and you will learn a lot from that. Did I answer your question?
Now I will take Nimran Sari's question.
Assalamu alaikum.
Walaikum salam.
I have a question. What we can call that thing, the pain type thing we feel in our heart that feels like it's inside the chest, heaviness and thing, whatever it is. What's that?
Okay, so give me an example so I can explain better. आपने कोई चीज बुरी देखी तो आपको दिल बैठ गया. That's what you're saying?
No.
Okay, so explain to me so I can explain better.
Like जो चीज आपने explain की है कि ये pain type sensation mind में होती है. I am
Mhm.
talking about कि ये pain type sensation heart में होती है तो ये क्या है?
Okay, so
अगर ये
जैसे
बात
हार्ट
हो
अटैक होता है तो वो हार्ट में होती है. That's what you're talking about?
No. It's a type of sadness. I think so.
Okay, अच्छा, तो सैडनेस जो होती है वो आपके दिमाग में होती है, ब्रेन के अंदर होती है. ओके, तो अगर आप न्यूरोलॉजी पढ़ें, साइकाइट्री पढ़ें, स्टडी ऑफ माइंड, साइकोलॉजी स्टडी ऑफ माइंड है ना, करेक्ट?
Yep.
कार्डियोलॉजी स्टडी ऑफ हार्ट है, करेक्ट? Yes or no?
Yep.
Okay, so you read cardiology. Does it answer your question? Yes or no?
Okay.
Do you understand? You're going to picking a wrong book or wrong subject. If I look at the renal disease for depression, you're picking a wrong area, correct? So you need to understand what are pardon. Going back in detail, for hundreds of years, we exactly know the sadness is in your brain. We have done ECT, electroconvulsive therapies. We have done TMS, transmagnetic stimulations. We have done deep brain stimulations. We have done surgery in the brain, and the person get better, correct? We have not opened up the heart to get better, right? So we are looking at the wrong direction. Even if you look at any textbook of cardiology does not talks about it. But we talk about heart as the problem. Actually, the problem is, and I will tell you what's the problem is. It's coming from the word qalb, correct? कुरान के अंदर कल्ब इस्तेमाल किया गया है, करेक्ट? अल्लाह ने कल्ब इस्तेमाल किया है. अल्लाह तो कल्ब कह रहा है, लेकिन ट्रांसलेटर ने कह दिया ये हार्ट है. तो हम ट्रांसलेटर को फॉलो करेंगे कि अल्लाह को फॉलो करेंगे? वेरी सिंपल क्वेश्चन. आई लाइक टू फॉलो व्हाट अल्लाह सेज. सही है ना? अल्लाह ने कहा है कि कल्ब है. What's the exact meaning of the qalb is? The exact meaning of qalb, you have to go to classical Arabic. Quran classical Arabic में आया, Al-Fussa में आया, correct? The meaning of from the classical Arabic is to understand something that's controlled or something that changed direction or changed position. These are the three meaning of the from qalb is. Now translator ने उस तीनों मीनिंग को एक वर्ड में कन्वर्ट कर दिया है हार्ट, और हम उस ट्रांसलेटर को फॉलो कर रहे हैं. अल्लाह ने तो कल्ब कहा है. व्हाई यू फॉलोइंग द ट्रांसलेटर? फॉलो व्हाट अल्लाह सेज. सुभान अल्लाह. आप उसका मतलब देख लें. इट्स नॉट करेक्ट. सुभान अल्लाह मीन्स फ्लोटिंग अबव एवरीथिंग. दैट्स द एग्जैक्ट मीनिंग. You need to know quantum physics to understand this concept. Majority of the time is written Allah ki तारीफ के, which is not the exact meaning. So it's the problem is The translator did the best they can, but it's not the correct what Allah is saying. So we need to understand Quran the best way, not what the translator said. And when the translator, we follow the translator, so we are not guiding ourselves. So you need to understand to get the knowledge from the original source. That's why you have Quran Hakim, correct? In Arabic. Study Arabic. Know Arabic. Rabbi zidni ilma, no other knowledge. Correct? And then understand Quran. You will be much better off. That's my suggestion to you. Wallahu alam, Allah knows the best. We can ask another question if you don't have a feedback or anything.
अस्सलाम वालेकुम सर, मेरी आवाज़ आ रही है?
हाँ बिल्कुल आ रही है आपकी आवाज़।
अच्छा सर, मेरा ये क्वेश्चन था कि जिस तरह आपने कहा कि अगर किसी को मीन्स के कोई इलनेस है, मेंटल इलनेस है या किस तरह की, तो आपका उस इलनेस से क्या मुराद है? क्योंकि अल्लाह पाक तो हमें कहता है कि मेरे जिक्र में सुकून है। तो
बिल्कुल
मीन्स के रूहानियत जो है हमने कुरान से लेनी है इस तरह से। तो अगर हमें डॉक्टर्स के पास इस चीज़ का इलाज लेने जाना है, फिर हमने इस्लाम से इस चीज़ को कैसे लेना है? ये मेरा एक क्वेश्चन था। क्योंकि समटाइम मुझे ना फ्यूचर को लेके कुछ इस तरह से बंदे को फेयर्स आते हैं समटाइम्स, और वो
ओके
मीन्स के बंदा टैकल भी कर लेता है, और उन फेयर से लड़ने के लिए हमें ईमान की ज़रूरत होती है। तो
बिल्कुल
अगर
सही
हम
कहा।
इसके लिए वो मीन्स के वो एक मेडिसिन मिलती है मीन्स के जो आपको रिलैक्स रखे, ये वो, तो वो बंदा ना ले, बंदा ईमान पे फोकस करे, उसी को मतलब उससे वो खत्म हो जाता है और होता भी है। तो हमें
ओके
फिर
तो मैं
मीन्स के आप ये कह रहे हैं, मुझे आपको वो चीज़ समझ नहीं आई थी, काइंडली मुझे वो बता दें,
ओके
और फियर को ओवरकम करने का इस्लाम में आसान तरीका क्या है, काइंडली वो भी बता दीजिएगा।
ओके
शुक्रिया।
चलें। बहुत अच्छा आपने सवाल किया। इसका कंप्लीट डिटेल मैंने आंसर लास्ट प्रेजेंटेशन में किया है, करेक्ट। सो तकरीबन 15-20 मिनट का प्रेजेंटेशन, उसमें इसी बात पे एक किसी ने पूछा था, तो मैंने उसको पूरी स्लाइड से बताया था। तो आप पिछली स्लाइड ज़रूर देखें। दैट्स व्हाई आई सजेस्ट यू टू लिसन टू माय प्रीवियस प्रेजेंटेशन। ये जो सवाल है ये लास्ट प्रेजेंटेशन में मैंने कंप्लीट डिटेल में किया। ब्रीफली मैं ये आपको बता दूं, देयर आर टू थिंग्स। देयर इज़ अ स्पिरिचुअल इलनेस एंड देयर इज़ अ मेंटल इलनेस, करेक्ट। दो चीज़ें डिफरेंट हैं, करेक्ट। स्पिरिचुअल इलनेस को मेंटल इलनेस नहीं बना दो और मेंटल इलनेस को स्पिरिचुअल इलनेस नहीं बना दो, करेक्ट। जिस तरह आपको डायबिटीज है तो आप इसको स्पिरिचुअल इलनेस तो नहीं बना दोगे ना, करेक्ट। सो स्पिरिचुअल इलनेस जो होती है, स्पिरिचुअल इलनेस से फिर स्पिरिचुअल डिजीज बनती है, मेंटल इलनेस से मेंटल डिजीज बनती है, राइट। सो किसी को अगर मेंटल इलनेस है और वो डिजीज में कन्वर्ट हो रही है, लाइक मेजर डिप्रेसिव डिसऑर्डर है, सही है, अल्जाइमर डिजीज है, करेक्ट, एंजाइटी डिसऑर्डर है, ऑब्सेसिव कंपल्सिव, उसको स्पिरिचुअल इलनेस नहीं बनाओ। क्योंकि अगर आप उसकी सही ट्रीटमेंट करोगे तो यू विल गेट बेटर। प्लस यू हैव टू फॉलो योर फेथ, अल्लाह से शुक्र अदा करोगे, अल्लाह से दुआएं मांगोगे शिफा के लिए। कोई दवा दवा शिफा नहीं कर सकती जब तक अल्लाह अप्रूव नहीं करे, करेक्ट। सो इवन इफ यू डू ट्रीटमेंट, अल्लाह ही शिफा करता है, सो अल्लाह के पास आप जाके शिफा मांगेंगे। लेकिन अल्लाह ने ये भी कहा है कि अगर आपको हर हर डिजीज का अल्लाह ने शिफा रखी है एक्सेप्ट डेथ, करेक्ट। सो अगर हुजूर सल्लल्लाहु अलैहि वसल्लम को हेडेक होता था या कुछ होता था तो हुजूर सल्लल्लाहु अलैहि वसल्लम चीजें करते थे, सिर्फ कुरान नहीं पढ़ते थे। हमें तिबे नबवी में पता चला है, आप पढ़ लें कुरान में क्यों शहद का जिक्र किया है। क्यों अल्लाह ने सिर्फ ये नहीं कहा कि सिर्फ कुरान ही पढ़ लो, आपकी सारी चीजें हो जाएंगी। शहद का क्यों जिक्र किया है, और चीजों का क्यों जिक्र किया है? कोई रीजन थी ना, जिसे कहते हैं रब्बी जिदनी इल्म। ये हमें दोनों चीजें करनी है, हमें कुरान भी समझना है सही तरीके से और इल्म भी हासिल करना है दूसरे तरीके से। जब हमें दोनों चीजें पता चलेंगी और राइट तरीके से पता चलेगा तो हमें इंपॉर्टेंस पता चलेगी कुरान की, कि कुरान किस लिए क्यों कह रहा था, सही है ना। तो coming back to this, we need to do when we required. अगर आपके अंदर mental illness के कोई issues हैं तो ज़रूर उसकी आप दवाई लें या जो उसका जो treatment है करें. Regarding the fear, fear is the same concept. Correct? You can have a fear, later on develop anxiety, later on develop other anxiety disorder, correct? So you need to develop that. So faith is very good to help you, but it does not help all the way. If somebody has panic attacks and panic disorder, faith is not going to always help because उसके अंदर mental illness है. आपने mental illness को solve नहीं किया है. आपने अल्लाह शिफा देगा, वो शिफा तो अल्लाह ही देता है, चाहे आप करो या ना करो, लेकिन आपको वो वसीला भी तो पैदा करना है. अल्लाह ने वसीले का भी कहा है कि आप करो. तो आप वसीले को आप सिर्फ कुरान पढ़ के कह दो कि हो गया, तो ये तो कुरान में तो नहीं लिखा ना. हुजूर सल्लल्लाहु अलैहि वसल्लम ने तो ये नहीं किया ना. तो ये गलती हमारी है ना कि हमने हुजूर सल्लल्लाहु अलैहि वसल्लम की सीरा नहीं पढ़ी और कुरान को फॉलो नहीं किया. होपफुली आई आंसर योर क्वेश्चन.
Assalamualaikum. Thank you so much for
वालेकुम सलाम.
So my question is that related to neurobiology, I wanted to ask that how can, since our brain it is neuroplastic and we can rewire it, so how can we change or rewire our brain so that we can become more strong mentally and more disciplined
Okay,
without being
that's a good question. So depends on आपका means psychology explained. ये completely detail में बता देती है, correct? If you look into psychology, the age of 4, you have what to do to improve your brain or your mind, the right way of approaching things, correct? When you develop gratitude, correct? Or you have inductive reasoning, deductive reasoning, when a child develop inductive and deductive reasoning, correct? So there is a pathway psychology explained to you, correct? अगर आप साइकोलॉजी अच्छी तरह पढ़ेंगे तो साइकोलॉजी एक्सप्लेन करती है कि इस एज में ये चीज़ें आपको करनी है, राइट? अर्लीस्ट एज में आपको लैंग्वेज डेवलप करना है, साइकोलॉजी बताती है. क्योंकि आप न्यूरो एनाटमी पढ़ें तो आपके मैक्सिमम नंबर ऑफ brain receptors are waiting for learning the language. The first 4 years or the 5 years are the best time of learning language. So आप कुरान पढ़ें, कुरान को हिफ्स करें, क्विकली आपका हिफ्स होगा क्योंकि brain is waiting for the sound. Because after a while, the brain, if does not hear the sound, it eliminates those neural connections because it does not needs it, correct? So it's better to use psychology to understand, and psychology goes into detail each group and each age group. You can do that. So specifically, you need to ask me what you want to develop. Can you tell me so I can guide you?
Yeah, actually, I meant for an adult, like if we want to be more disciplined or we want to be more strong, like for
Okay.
example, developing a habit of reading as an adult,
Okay.
or yeah.
Did you listen to my previous presentation? I actually went into the explain self-esteem to develop confidence. I also talk about habits, how habits are formed, how to develop a good habit, how to minimize bad habits. Through neurology and psychiatry, I explained that. Did you got a chance to listen to that?
No, I will check it out. Thank you so much. Actually, today
Sure.
is the first time I'm listening to you.
Okay, definitely. It's available 24 hours, 7 days a week.
Thank you so much.
Next question.
Now I am taking Sultan's question.
Assalamu alaikum, sir.
Walaikum salam.
Sir, hope you're doing well. Sir, I have a very personal question. I mean, in my previous, I am 23 years old right now.
Do you
And for
want
the,
to share personal information to the world?
I mean, yes, sir, I really do want to. Not,
Okay,
not
so
as
we
that
have to.
sort.
Okay, so I just want to be very clear because the whole world will know and listen to you. So you are aware and you're going, but we have to stay within the paradigm of ethics,
Just,
correct?
just my experience, nothing else. And there's nothing bad about it. Just so
No, I'm
that you
just
know.
setting the limits. Always I
All
have
right,
to.
perfect, perfect, perfect,
For
perfect.
yours and for other people who's listening.
No worries at all. All right. So I have listened to your whole of this presentation. First of all, I would like to ask that where can I find, because you've mentioned it about 4 or 5 times, if you might look into my previous presentation. The number one, where can I find that so that I could have a look into it? And
So let me answer
number,
that. So let
sure.
me answer that. If you go to IMS website and put my name, Najeeb's lecture, it's all of them are there. It's
All
on
right.
YouTube. So that's the answer to your question.
All right, perfect, perfect. And number two, now, sir, because if somebody very close to me or to my one of my family members, and I have had not good experiences, or I was using some substances in the past, which had caused, I don't know, in my research that it has caused some damage to my brain, and as the previous girl who asked the question that how can we rewire, or how do we know that the damage that has been done to the brain by using those substances, how can we actually recover from that?
Okay, so answer to that question is now you have realized, and that's it's good thing that you have realized it. You know, you're going in a positive direction. You're not. So remember, you have to develop resilience, correct? Come out
Yeah.
of it and move in a forward direction. You learn from your mistake, not go back, correct? That's what your
Right.
goal is. So you have to develop healthy habits. I went into healthy habits, correct? People in other countries have alcohol issues and other things, and they suffer a lot, and they have to come out and develop resilience, correct? So I have went into minor detail in habits, self-esteem, and all those things. That's all available on YouTube. You can listen to it. Self-esteem will help you develop confidence. The Islamic self-esteem, you need to develop that. And those all things. So it's all available on my YouTube presentation in detail. So that will help you.
All right, thank you very much.
You're most welcome. We can go to next question.
Now I am taking Zoha's question.
Assalamu alaikum.
Welcome, Islam.
I just wanted to ask, I don't deny that the main center for thinking is brain, but the recent studies have proven that our heart have its own independent nervous system, which is
What
called as
study?
little brain. The recent studies. Now, I don't exactly know the name of the scientist who have discovered, scientist or who have discovered the studies or given his point, but the researchers have found and proven that our heart is independent nervous system, which is called as little brain, and it has approximately more than 40,000 neurons. So, what are your opinions on that?
Good question. I'm glad you asked this question. Correct? This is your heart. I was expecting this question. Correct? This is how your brain connect to heart and goes back. Correct? We already know that about that. Up till today, in medical college, in any country, this is how it's being taught. Correct? So if a new study comes, I will go into right now. I will tell you about the new study. But up till now, a medical doctor knows the brain controls the heart. It's not the other way around, correct? Listen to me because you will have questions. So you go to a medical doctor and say that I have depression from the heart, he will send you somewhere else. I'm not going to say where he's going to send, right? Anywhere in the world. So that's one thing. This is my presentation. I went into I have means training in psychiatry. Then I went to geriatric psychiatry, then fellowship in geriatric psychiatry, then into research, then published paper based on memory system, and then published it. So if you want to listen to a Muslim who have done research, went into autopsy of a human brain of 313 and look at the diagnostic criteria, that's me. Correct? So I'm looking for somebody who can tell me something else because nobody up till now has proven the other way around. Now, one you are talking about, I am aware of it. By the way, this is what actually Maulana Maududi talks about when he's talking about your when Allah says qalb, that's mean mind. Check Surah Sijda, page number 42, volume 4 in Urdu. So at least you're aware is there. Now, if you deny it, that's your choice. Maulana Maududi explained that. And Surah Allah also explained that, right? So that's it. So you cannot deny Surah Alaq, right? Now coming back, this is the new study. If you're saying that 40,000, this came into in 2023, talking about impact of nervous system, arteries, heart, and neuroimmune cardiovascular circuit hypothesis, correct? And actually, if you go into minor detail, since I have done complete research on that, I have read this, correct? It talks all these systems, and it all says that there's a nervous system that controls everything. Now, the one you're talking about is neurocardiology, first time published in 1994. That's the first edition. The second time it was published in 2004. The one of neurocardiology, you talk about mini brain, the 40,000 neurons, correct? Since 2004, nothing has been published from that book. And this is published in 2023. You can review it, understand it. It goes in detail how the nervous system works. And why you're going against the Quran when Allah is talking about in Quran in Surah Alaq? Is Quran more important than something else? You need to think. Means Quran is the golden rule, right? Well, Surah Alaq said sinful, lying, forelock. You don't need any evidence. It's written in black and white, correct? So let's follow what Quran says, correct? So I always follow what Quran says and see where the neuroscience explain. And even if you go into detail, we went into, like, for instance, this thing. Can you explain in heart where this system works? Because we know in brain it works. So we need to understand which neurons are in the heart that works, right? It has to be. Means there has been 100 years we have know that its brain works, but nobody has proven where are those. And in the case of memory loss, like Alzheimer's disease and all those things, we look at the memory functions, correct? When your memory is gone, you don't going to think about it, correct? And that is in the brain, not in the heart. So that is a misconception, as I mentioned to you, is coming from the translation of qalb, because we connect qalb with the heart, not knowing the al-Fussa, which is a classical Arabic, says that understand that is center or changes the shape. That's what Allah is saying. So I want you to understand qalb as qalb rather than somebody translating it into heart. It should be qalb. Hopefully I answer your question, but it's a good question.
Ayan
We can
Khan,
go.
you can ask your question.
Okay, my question is regarding the few questions earlier, but you didn't give the proper answer to that. Like, I understand that. Hello,
Yeah, I
am I
can hear
audible?
you. Yes.
Okay. So my question is like from few questions earlier, where you mentioned that like you basically mentioned that the pain is perceived in the brain, right? So I understand and I believe that. But my question is this, that when we think of a tragic past, we feel some stingingness in our heart. It feels like that someone is pinching a needle in our heart, a sharp
Mm-hmm.
pain, or sometimes a tightness of chest, or sometimes, the one you mentioned, dil baith gaya. But all of these are three different scenarios, right? But it's still sometimes it's related to memory, but it happens in the heart. So what is that thing?
That's a very good question. I'm glad you asked that question. Okay, so give you example. You saw an accident, right? Somebody died in front of you. आपका दिल बैठ गया. That's what you want me to explain?
No, all of those three scenarios, not just.
Pick
दिल
one
बैठ गया.
scenario, then I will answer each one of them. Pick one.
Okay, first this one, दिल बैठ गया.
दिल बैठ गया, कोई रीजन होती है ना, क्यों बैठा है,
Yes.
क्या रीजन है?
कोई मिसाल के तौर पर कोई फियर है फ्यूचर का, या भी आपने जो पास्ट का बोला
ओके, तो ये
वो.
दिल बैठ गया क्योंकि आपको फियर है, fear of losing a job or something, correct? Somebody is leaving you or some disaster is coming और आपका दिल बैठ रहा है, correct?
Yes.
I'm correct? ओके, जी ये कहाँ बन रहा है? आपके ब्रेन में बन रहा है ना फियर,
Yes. Yes.
और फिर ब्रेन ने क्या किया? ओके, सो ब्रेन ने आपका, लेट मी आस्क लुक इन, एक्चुअली ये मैंने पहले आपको दूसरी स्लाइड्स में बताया हुआ था, आ, लेकिन मैं इस स्लाइड में वापस से बताता हूँ। सो आपके ब्रेन में किसी का फियर हुआ है, ठीक है? कहाँ फियर डेवलप हुआ है? आपके ब्रेन के अंदर डेवलप हुआ है, करेक्ट? आपका फिर तीन सिस्टम किक इन होते हैं, सेलियंट नेटवर्क which is autonomic thought process, right away thought process develop होता है. That thought process goes to your limbic area, from the limbic area to the hypothalamus, and hypothalamus के through different areas ऑफ द बॉडी चले जाता है. नर्वस सिस्टम में ऑटोनॉमिक नर्वस सिस्टम को एक्टिवेट करता है, रिवॉर्ड एंड पनिशमेंट को एक्टिवेट करता है, आपका पनिशमेंट किक्स इन हो जाता है, रिवॉर्ड suppress हो जाता है, you had a fear, significant fear, and you have a right away response coming, and that goes to the spinal cord, it goes to your heart with through the vagus nerve, which is decrease the stimulation of heart rate and all those things. You feel like heart is slowing down, right? Coming from your brain, right? अगर आपको थोड़ा देर लगाएंगे तो आपके फ्रंटल लोब में जाता है. दिस इज द कॉल्ड सेंट्रल एग्जीक्यूटिव नेटवर्क, which is called alternate thought. I explained in the previous presentation the detail. So you think about it. When you think about it, it gives response back over there to the limbic area, the hippocampal area, which is the memory area. It calms down. When it calms down, it's sent back over there to the hypothalamus, which is the center of autonomic response. It sends all the stimulus back to the spinal cord. Spinal cord goes to the heart, and it goes back to restate itself, correct? So that's it. The third one is default mode network. There's a deeper thought, which is in different areas of the brain, where you are in the state of prayers, deep thought. When you think about it, it calms you down. So it's all in your brain. It's all in your brain, and it passes on to your heart as well as other areas of the body. Sometimes you have twitching, correct? Sometimes you lose sleep. Sometimes you have GI problem. You can have upset stomach, right? Where is coming from? It's coming from the brain. Everything is controlled by the brain. It's sent it back to your body by nervous system. So it is your brain that sends back. We already know for more than 100 years. We have a system. We can test this thing on the spot when a person is developing. We do fMRI, right? When we do fMRI, which is MRI with a functional one, we give a task to a person to do or read something, and we scan the brain, and we have a increased blood supply in that area of the brain. So it's all in the brain, transmitting back to the heart and other areas of the body, right? When you have stress, your diabetes get worse. Your other things get worse. You may have chest pain, right? People get chest pain under stress. So all starts from the brain and it's transferred back to the heart and other organs of the body. Hopefully I answer your question.
Okay, so the rest of the two scenarios are the same. It
Okay.
starts or initiates in the brain and then goes to the heart.
Yes.
You answered my question.
Thank you.
Saida Sidra Asif, I'm taking your question for now.
Assalamu alaikum.
Walaikum salam.
The question I want to ask is that you explained that the pain, whether it is emotional or physical, it comes from the brain. So, are you basing this only on the research that has been done up till now? Has no research been done regarding the heart or the control of the heart over this pain, or just because neuroscience says that it is so, so on the basis of that we are concluding that only brain is controlling the pain. um, this and there is also a phrase, they say that somebody died of heartbreak, so
Okay.
even doctors use it. So is this not something that is considered? Because in surah al-hajj, uh, the verse is that it is indeed not the eyes that are blinded, but blinded are the qulub within the sudur. So, are you trying? Are you implying that maybe we are not considering the meaning of the kalb and the sadr in a correct way? Are you trying to say that the kalb and the sadr do not mean heart and the chest, rather it means some part of the brain?
Yes.
Uh,
And
that's what.
okay, so let me answer your question, correct? You're talking
Yes, sir.
about Surah Araf. This is what you're talking about?
Surah al-Hajj.
Oh, Surah Hajj. Okay, that's fine. It's just the same. It also says over here, we have destined many jinns and human being from hell, those ones who have cull, with which they do not understand. They have eyes, but they do not see. They have ears, but they do not hear. Correct? They are like animals, or even worse. Correct? This is from Surah Araf, but you're talking about Surah Hajj. उसमें भी यही कहा होगा, सही है ना? ठीक है ना? So अल्लाह ने जो Arabic में कहा है, we need to stick to what Allah has said, right? Very simple. You and me will agree on that part, correct? Allah ने अगर जो Arabic में कहा, that's the right thing, correct? Now the translator has translated to the best of the knowledge. So if you're following the translator, this is not necessary it will be 100% all the time correct, right? Means subhanallah, I give you example, the translator has not translated correctly, correct? I explained to you, correct? Before that, whatever the thought process is, they did that, right? So you need to understand the translator has a shortcoming, but you need to follow what Allah is saying, because I will follow what Allah says, not what the translator said, right? So when we look into al-fussa, which is a classical Arabic, I explained to you what's the meaning of the kalb also. So as the sadr as well as fuwad, these are three terminology used related to that, correct? They are very similar, and you have to understand the akal and the ilm also, correct? Because where's the akal? Where's your ilm? Correct? Where's your hidayat? Correct? These are all in your, where's Allah ask you in Surah Alaq? Correct? The lying sinful forelock. We cannot deny that. It's written over there. So if we change, then you are creating controversy in the Quran, right? Allah has already said in Surah Alaq, your forelock. So this is where it is. We have understood the best we can, but we need to focus what qalb means, and we can get that answer from classical Arabic or al-Fussa, and then use the knowledge of Rabbi Zidni Ilma to understand what Allah is saying, right? And when you put everything together, you realize that your belief, your memory system, your akal, your ilm, all is in the brain. And that's why Surah Alaq makes sense. So I cannot go against Surah Alaq. And if you looking at Maulana Maududi in Tafhimul Quran, I showed to you. He mentioned again and again when we are talking about dil, it means mind, correct? So Maulana Maududi spent 20 to 30 of research in Saudi Arabia and then published Tafhimul Quran. So read about it. There are other scholars who have said that. Zakir Naik, listen to his videos. He goes in minor detail about it. He's a physician. He goes in minor detail. And there are a lot of other physicians or scholars have said that. So it's up to you what you decide, but you have to understand, does it make sense? If you learn about neurology, psychiatry, and Quran, You have to understand, put together why Quran is saying that. Because if you put qalb as hard, then Surah Alaq become a problem. You need to understand we cannot have controversies, correct? And it makes sense that if you have the right meaning of the meaning of qalb, then it makes sense. Something that understand, because the brain understand, something which is in the center, brain is the center, something that you change your thinking process. So it makes understand why brain is what Allah is trying to say. That's why you have a memory system. That's why you have akal, you have ilm, you have hidayat, correct? Otherwise, the problem comes is if we say it's the heart, then we will find excuses. Because मेरा दिल नहीं कर रहा, कर लो गर्ल, आप कभी अपने आप को अपनी हैबिट ही नहीं चेंज करोगे. If you understand it's in your brain, you will find the reason why you're doing, what is unconscious mind is doing, how it's developing, your unconscious mind provoking it, correct? I went into the autonomic thoughts, alternate thoughts. What are the process in the brain that pushes you, bring waswasas in you? Shaitan bring waswasas, correct? And I ask the same question when you read Quran, how it goes to your heart. People cannot explain properly. You have to tell me the pathways where the image is formed on the retina, to which nerve it goes step by step. It's all in the brain. Has not reached the heart. Brain decide what to do. So when I ask this question, people don't have the answer because there is no answer. So I'm just telling what is the neuroscience says, or if you're not, then go to cardiology and learn from it. Cardiology has not found anything, and the whatever is found, I have given you. The new research and everything in the last 50 year research showing the brain is the one control, and I gave you the example. And the book which you're talking about was last published in 2004. Right? So it's up to you, whatever. Wallahu alam, Allah knows the best, but I'm just letting you know you need to learn more what's going on and how things are in neuroscience, and this has been established. So it's up to you, whatever you want to follow. I'm not the one who's advocating, but I'm just giving the information because I've spent enough time looking into the detail on the autopsy of the human brain and published papers, correct? So to let you know, correct? That's but wallahu alam, Allah knows the best.
Muhammad Faik Ali, go ahead and ask your question.
Assalamu alaikum.
Walaikum salam.
My question is that in Surah Nisa, verse number 56, Allah Ta'ala फरमाते हैं कि जब दोज़खियों की खालें जल जाएंगी तो हम उनको उनके सिवा और खालें बदल कर देंगे ताकि वो अजाब का मज़ा चख सकें. तो आज जो है साइंस ये प्रूव कर चुकी है कि जो हमारी स्किन है इसमें भी जो है पेन रिसेप्टर्स होते हैं. आई एम नॉट डिनाइंग और डिसएग्रीइंग विद यू. द होल कन्वर्सेशन एंड द होल प्रेजेंटेशन बहुत ज़बरदस्त थी, बट ये जो वर्ड्स है क्या ये कॉन्ट्रडिक्ट नहीं करती?
No, अच्छा, आपने सवाल अच्छा किया, लेकिन इसका जवाब भी बहुत सही है. अच्छा हुआ आपने ये सवाल किया. द पैराडाइम चेंज. हम दुनिया में नहीं रह रहे, करेक्ट? हम दोजख में, करेक्ट? दोजख में आप मर के भी जिंदा होंगे, मौत आएगी नहीं. तो ये डिफरेंट पैराडाइम, correct? Yes or no? So when the paradigm change, how we are using the same system of the earth? Paradigm has changed. There is no time. Sensation is different. सूरज आपके सर के ऊपर होगा. बेटा अभी कर लो, सूरज सर के ऊपर और हशर क्या होगा आपका? So paradigm change. When the paradigm change, lot of equation change. Do we know everything? No, I am not in the dozak right now. So how would I say what the science will say? Science has no idea. Correct? Does it make sense to you?
I am unmuting Marine Tahira now. You can ask your question. Go ahead.
Assalamu alaikum.
Walaikum salam.
Firstly, I want to know the long discussion I have listened. I just want to know, are you totally detaching heart, the organ heart, which we means in English, which all the members are discussing, that organ heart, you are detaching, it is of no value? Yes or no? And my second question is about neurology, and I am in confusion about music. Means I have heard and I have experienced that whenever we are listening music, all the neural system in our brain, all the areas of our brain start working together, and it is a kind of therapy I use for myself. But when I go for our theology, Islam, there are contradictions on that. So I want to clear about the science and Islam about music. And my first question, is there no value of this organ heart at all, or is there anything?
Okay. So heart has means it's ultimately very important. You know, if you stop the heart, how you think, correct? Means brain and heart works together, correct? Means if you stop the heart and the brain is alive, then you're still alive as long as the heart is pumping, correct? But if the brain dies and the heart is working, then the heart will die. That's a simple fact. Heart and brain works together, right? So we're not disregarding heart. Heart is there to survive so it can supply the blood supply to the brain, correct? Just like you need water. You cannot take away water and say, I can live without water. Does it have water as important? Significantly important, correct? So the heart is significantly important in human body, but heart has its own boundaries. We cannot make heart everything, knowing that heart does not have those boundaries, correct? So we need to, so that's why we understand cardiology, right? We read cardiology and we understand what are the limitation of heart hours, correct? Well, heart does not think. So why we put heart as a thinker? Akal is not in the heart. We know that, correct? So we
Okay.
have to understand where the boundaries of the heart is, but heart is very important.
Okay, can we say that it is only for heart duty, means pumping the blood in the body?
No,
It is
it's more than that.
sig-
It's more than
what's
that.
that?
It is more than that. It's more than pumping.
What's
It does
that?
a lot. Read the cardiology.
Okay.
This is a whole science. I cannot explain the whole cardiology in this short period of time, right? Heart
Okay,
has a
okay.
lot of functions, but heart does not have memory. If you're comparing
Okay.
memory of the brain versus heart, heart does not have that memory. That's the point.
Okay, thank you. For the second question, I
Abdullah,
want to
I am taking your question now.
actually I want to get answer for my second. That's very important.
Okay,
You
so
can ask.
briefly, I answered that this, as far as the music is concerned, it affects your brain definitely. And why it goes against Islam? Because Islam has its own criteria regarding the music, because the music will take you to a different direction. And if you're, and basically that's why you will skip the prayers or doing good things. So that's why it goes into that direction. So that's why Islam wants to you to remember Allah, think about Allah, rather than going in the direction where it will avoid going towards Allah. So that's why it is. So that's why Islam says that, and the music has phenomena attached to that. So that's why Allah means Islam forbid going in that direction. That's my understanding. Wallahu alam, Allah knows the best.
Thank you very much. Jazakallahu khair.
Now I'm taking the last question. Abdullah, I'm taking your question and I'm unmuting.
Can you hear me?
Yes.
Okay. I have two related questions. The first is how the front side of the brain, while prostrating, that is sajda, helps in controlling our thoughts, number one. And the second is, how can we somehow fix our brain's weights to positive side, because it is said that when we are in sajda, we are nearest to Allah. So I want my neurological weights to lock at that position. How can I do that?
A good question. Okay, so you think from your brain, correct? Or you think from the heart? So you think from the brain or from the heart?
From the brain, obviously.
Okay, good. So that's very important to understand because how your thought process is, right? So when you are in sajda, what is your thought process? You're letting your ego down, correct? You're saying to Allah, I don't have, you give all the praises, you have all the power, I don't exist, correct? You give the blessing and I will move forward. So you're putting your ego down, you're putting your intellect down and asking Allah's blessing, right? And when you're putting in that direction with Allah blessing, it will help you, right? That's why Allah likes you to be in sijda, correct? Allah likes you to do the dua in sijda because you're putting your ego down. You're putting your brain in that phenomena that your ego is down, you're letting it go, and you're asking for Allah's help. So you're changing the system of away what the shaitan says, correct? That you are the Almighty. No, Allah is Almighty, correct? So Allah will help you when you have that thought process. So you're going into deeper mode, default metacognition level, correct? And that will help you, your brain rechannel that way, correct? Also, I explain in the habits, the detail how to develop good habits and bad habits, and you have to read some more about the psychology of the brain, neurology of the brain. So it will help you in that direction. My previous presentation goes in minor detail about that. That will help you. So hopefully that will help you to answer those questions.
जो क्वेश्चंस रह गए हैं वी हैव द फीडबैक फॉर्म फॉर इट आप अपना क्वेश्चन वहाँ पे शेयर कर सकते हैं फीडबैक फॉर्म का लिंक हमारे चैट बॉक्स में शेयर कर दिया गया है सो लेट्स कंक्लूड दिस सेशन दिस सेशन हैज़ बीन ट्रूली मीनिंगफुल एंड इंसाइटफुल may Allah guide us to act upon this knowledge thank you all for being such a wonderful audience Jazakallah khair assalamu alaikum wa rahmatullahi wa barakatuh
Thank you very much for coming. I'm thankful for Allah to giving me this opportunity. May Allah forgive me if I have a shortcoming and anything I said right, it's from the blessing of Allah. And we'll go from there. Hopefully you benefit and please review previous presentation on IMS website. Or I have 8 presentation already done for the last whole year. So it's available and you can review and learn from it. If you have any questions, please give us send me the information and I will do my best to answer that. Jazakallah. Thank you very much for coming.